Inflammatory arthritis. To put things simply, let me ask you a question. Raise your hand if you have ever experienced joint pains, back pains, neck pains in your life. If you have raised your hand now, let me get to the interesting bits. All joint pains, back pains or neck pains may not be due to arthritic diseases. Most cases, in case of elderly people, you may see that your grandmother or grandfather complain of knee joint pains, neck pains. They might not always be an inflammatory arthritis, which is what I deal with. They might be due to mechanical wear and tear of those joints. However, what I want to talk about are inflammatory arthritic diseases, in which case you will deal with joint pain and joint swelling. These diseases usually affect younger patients. They might find it difficult to move their hands or feet. They may complain of swelling of these joints, inability to move or do their daily activities, and sometimes, very, very interestingly, these diseases are not restricted only to joint pains. So a patient with inflammatory arthritis, unless treated properly, might also end up with red eyes, damage to the eyes, might end up with some lung problems, breathing difficulties, might end up with renal problems, kidney problems, which are all because of this underlying arthritis which has not been diagnosed. So how do we diagnose this? Like I said, joint pain, swelling, stiffness that is more in the morning, these are some of the important signs to look out for. We of course go for some blood tests or x-rays, but you don't need to worry your head about that right now. We are there to take care of you if you have these complaints. My point is, if you have any of these complaints like joint pains with swelling, maybe with fever, maybe with red eyes or breathing difficulties, sometimes even skin rashes or joint problems with kidney problems, all this might be due to inflammatory arthritis. That is an autoimmune condition. It is not just a pain complex. At CMRI hospitals, we have now started to operate an inflammatory arthritis clinic every Tuesday at 2 p.m. Feel free to come and let us have a look at you. Thank you.